Good evening, guys. Good evening, guys. Good evening. Welcome to Let's Talk. I'm so excited about tonight's show. So come on in. And as you come in, let me know that you're here with Juju. Also, if you would do me a great big old favor and like and share the video, tag a friend, let them know that Juju's on the air. And tonight we will be discussing a very, very important topic. So come on in, guys. Come on in and join us tonight for our very important discussion. Um, how has everyone been? Hello, Mr. Jackson. How are you doing?
Good evening. I'm great. How are you?
I'm doing well. I am doing so well. I'm so excited about tonight's show. I'm so excited about our special great guest, Dr. Alveta Reese. But anyway, tell me, Mr. Jackson, you told me you've been phone banking, so tell me how that is.
It is absolutely so rewarding. I did phone banking for about an hour today, and I was calling. Of course, it's a random choice, and all the people that I spoke to just really, it just gave me life because most of the voters said I've already voted.
Okay.
And then I had to encourage them to come down and volunteer or to do a call to action, and make sure that they recommend that early voting is up, it's still available until Friday, November 1st. And
Okay.
I gave them the address of where we were located and they could come um, and could work and volunteer with us. It was very rewarding because um, nobody was rude to me, and the number
Oh,
was and the number was showing up. What is it when you don't when the number doesn't show up? It shows up as a block
unidentified caller or
unidentified
something like
number.
that.
Yes, but
Okay.
people were still answering. One particular call that really inspired me was a member of Delta Sigma Theta. She said that I've already voted in all of my sorors. I'm on three or four different um, committees, and we're getting people out to vote. And it was very exciting.
Oh, okay.
I never got any pushback.
Okay.
And what I am learning is if I just relax and let the Lord do His thing,
Uh-huh.
then things will come out in our favor. But for the
Yeah.
most part, people are already voting or they've already made up their mind.
Okay.
But what I am seeing is an influx of um, conversations of Black men beginning to think twice about what they've been fed. They're now
Yeah.
turning their heads to and their hearts to really see how detrimental this election is going to be and why it's so important that they do research and understand. um, I just, I've got to be on so many calls, but it's okay. I'm excited. But today was a good day. I feel like I gave something back to the community, and
Well,
I'm going to go back again.
good.
So,
So you were phone banking in Georgia. You were doing Georgia voters.
yes, I did local this
Oh,
time. Typically,
okay.
when I first started, I was doing Pennsylvania,
Right.
Wisconsin. I was doing the battleground states.
Right.
But we have to be careful about whose polls we're listening to and what
Yeah.
polls we're listening to and what we're watching. And what I've learned is, and this is from a personal perspective,
Hmm.
the loudest people don't determine the outcome of the election.
Right.
It's the voters. It's the voters. It's those people that are quietly not saying a word but are already voting because
Okay.
what I've been told, and this was an eye opener for me. My one of my peers um, called me and we had dinner 2 weeks
Mm-hmm.
ago, and he said,
Mm-hmm.
I got something to tell you. I said, oh my God, what's the matter? He said, well, no, I just want to let you know that my wife and I voted for her. I said, what do you mean, voted for her? I didn't know what he was talking about. He said, well, we voted for Kamala Harris. We're
Okay.
just not loud about it, and we've been lifelong
Oh,
Republicans. And he said,
okay.
we're just not putting up with the foolery and the clown show. And they didn't vote for him last time, but they didn't vote at
Oh,
all. But in
okay.
2016, they voted for him, and they're lifelong
Okay.
Republicans. And
Okay.
I just watched another training video of some women in Arizona, and this was striking to me. They're members of Latter-day Saints. They are Mormons,
Okay.
and they said that they are staunch Republicans, and they're now supporting Kamala Harris,
Okay.
which was which was I don't know if you know anything about LDS Latter Day Saints.
Not
That is
a whole lot,
that's
you know.
Mitt Romney's
Right. Right.
re-
Mm-hmm. Mm-hmm. Yeah.
religion, and they
I
are
know he's a part of that religious group.
they're
Yeah.
very, very, very conservative.
Mm-hmm.
And one woman has 10 children, and she said that all her and her whole family are supporting Kamala Harris. And the biggest decision for them was Roe versus Wade. And
Really?
she even spoke about one of the ladies said that in 2016 she was bleeding and had to have a
Oh,
DNC. And
okay.
if that were to happen, if Trump were to get into office, she wouldn't be able to have that, and she said she could have bled out. So,
Okay.
but
Okay.
anyway, and by the way, Juju, you look gorgeous. I
Well,
love the
thank you.
pink. You look really
Thank
beautiful.
you. You like
You-
my hat and earrings? I
I,
made those, of
I
course.
love everything. I already know you did, baby. I love everything about it.
Well,
You
thank
always make me so proud. You
well,
know that? That is for sure.
well, thank you, man. Thank you, sir. All right, so let me go ahead and then greet some people. How about I do that first? Let me see.
Are you ready
Uh,
for me to pin that? You're ready for me to pin that information too, right?
Yes, I'm ready for you to pin that information. But anyway, hello, Starsha Lawrence. Thank you for joining. Mr. Michael France, Miss Kashina J, Miss Annie Jones, JJ Bendy, Miss Alveta Reese. And we're going to get you in here, Alveta. And just thank you guys all for joining us this evening. And as always, when you come in, Althea, how are you doing? When you come in, if you would please like and share the show and tag a couple of your friends. Let them know that Juju is on the air. Hello, Tish Chambliss. How are you doing? But anyway, so tonight we're going to talk about breast cancer awareness. But anyway, welcome to this week's edition of Let's Talk. I am your host, Juju, and I'm coming to you live from my living room this evening. Let's Talk, of course, is produced by my dear brother, Mr. Jerry Jackson. Mr. Jerry Jackson always has my back 10 toes down with me all the time. There is so much for us to talk about, so we're going to get right to it. But first, I do need to remind you that this is not intended to be a news show, but we will do our best to steer clear of gossip and things that we know are not true. And it is my sincere hope that everyone finds this to be a safe space where you can feel comfortable sharing your opinions and asking any questions. Tonight's show is Breast Cancer Awareness. We have a very special guest with us, Dr. Alveta Reese. She is an oncology nurse. But first, as usual, we want to start off by giving you a bit of updated information about election 2024. Of course, there are just 9 days until the general election. It is on November the 5th. There have been people giving out false information about when the election date is. So note it is Tuesday, November the 5th. That's next Tuesday. And we are now at the point where the electorate must make a choice. And we have two two diametrically opposed candidates with very different views of what America's future should look like. And so it's our choice. It's up to us to choose. And my pastor preached today about choose life. And Moses told the people, I'm giving you a choice, life or death. And I advise you to choose life, but we have a choice. We can choose between freedom or being in bondage. We can choose between democracy or autocracy. We can choose to have a president or a dictator. We can either choose someone who wants to move this country forward or someone who wants to move this country back to a very dark time for many groups here in America. Okay, so it's your choice, people. It's up to you. Your choice. Just make sure that before you vote that you know the facts and that you vote in a manner that's going to have the greatest positive impact on you and your community. But anyway, so most of us know that October is Breast Cancer Awareness Month. And I also want to say that I know it is also Domestic Violence Month, um, which is a very important topic. And hopefully in November, we can go back and talk to and deal with domestic violence because that is something that it is very important. But anyway, so we know that October is Breast Cancer Awareness Month. And so tonight we want to focus on the who, what, when, and where of breast cancer. We are blessed to have with us tonight Dr. Alveta Reese, an oncology nurse since 1989. And as always, I want you to feel free to place your comments and questions in the chat, and we will do, as usual, we will make it a point to try to address all those questions and comments during the show. Also, I want during this show that if you are a breast cancer survivor, you have survived breast cancer, or you're in the fight right now, please type in the chat, I'm a survivor. And I will have gifts for everyone who types in during the live, not on a replay, but you have to be during the live. I'm a survivor, and we'll get that information and how I'll have gifts to you, and you'll be able to pick them up at the fall festival that we're having at St. Luke on November the 2nd. All right, so let me bring on Dr. Reese. There you go.
Oh, hello.
Hello.
How are you
Hello.
doing?
I'm doing great. How are you?
I'm doing well. I don't know if this lighting is gonna.
You
I'm trying to
look
turn it.
fine. You look
Okay.
fantastic. We see you perfectly.
Okay.
Yes.
Very good.
Yes,
Very good.
ma'am. So thank you so much for taking time out of your very busy schedule to come and join us tonight. And, of course, we know breast cancer is a disease that impacts a lot of women. And so it is so important that we try to get them the right information so that we can do, or we as women can do what we need to do to try to prevent breast cancer. If we have breast cancer, where do we go? What do we do? What works? What doesn't work? What's true? What's not true? So you're going to tell us all about that tonight. And thank you so much. Thank you, Mr. Jackson, for getting Dr. Reese here with us tonight. And so, first of all, Dr. Reese, I just want you to tell us a little bit about yourself.
Well, Thank you so much. Thank you for this opportunity. And I definitely want to thank you and Mr. Jackson. I think that this is so important that you're getting true information to the community and to people, because we know that knowledge is power, but it's the application of knowledge that moves us in the right direction. So I am born and raised in Columbus, Georgia. You think about your when you start to think about your background, you think, oh Lord, how did I get here? And it was nothing but the Lord.
Okay.
um I was a child of a single mom whose family raised myself and my sister, and had an aunt who just bugged me every day after graduating high school to go to nursing school. And
Okay.
I did not like blood or anything like that. And I'm like, well, I'm just gonna go and take this test so she'll quit calling me. And that's what she saw in me. And I
Okay.
thank God for giving her that vision. But have worked with cancer patients since 1988, and just realized that that was my calling. That's the calling that the Lord put on my life. And I'm so thankful for it. And part of the information I'm going to give us tonight really shows the transition, how far we've come, how the research, the technology, the medications have advanced to the point where breast cancer is no longer a death sentence.
Mm-hmm.
Breast cancer is a disease, a number of diseases that we deal with, and we have ways of dealing with it so that it is not life ending. So that's
Okay.
a big message I want to get out tonight, and that early detection is the key.
Okay.
So when we talk about who, what, and when, and where, and why, cancer itself is just a uncontrolled growth of cells. The
Uh-huh.
way the God programmed our bodies is our cells, certain cells grow in a certain way, and then they stop or they slow down. A cancer cell has mutated or changed. So it's not following the program anymore. It says,
Okay.
okay, I'm going to grow out of control. I'm out of control. I'm just going to grow
Okay.
out of control, and I'm going to affect as many cells around me to grow out of control. So that's how it starts. And the reason we know that early detection is key because it is so important that all of us know our bodies.
Mm-hmm.
When there is a difference or a change, we need to follow up. And now medicine is to the point where we have to advocate for ourselves.
Yeah. Yeah.
If I go to the doctor and I've got a problem and they don't talk like I think they ought to talk, I'm going to go somewhere else.
Okay.
And we have to do that. We have to advocate for ourselves. We also have to get people around us, just like this show, get the information. Know that, hey, something really isn't right. Maybe I can call somebody to help me with this. My number's all over the world, everywhere, and I'm
Okay.
always available to talk or to answer questions. I have credible resources to send
Oh,
you to. The internet is not all
right.
good, all the information is not correct. So we want you to go to those credible sources to read things.
Right.
TikTok is not a good place to get your medical information.
And unfortunately, so many people get so much information off of TikTok and other social media sites and are misled because there's so much bad information out there. So
Correct.
thank you
Correct.
for letting us know that TikTok is not where we want to go to get our medical advice.
Absolutely. Absolutely. So when we look at early detection, we're talking about mammograms, we're
Mhm.
talking about your breast self exam, but it's come to the point where you do need to know your body and notice a change. But the mammograms and the MRIs are the things that can diagnose it very, very early or see a change very, very early. A cancer can only be diagnosed through a biopsy, which means they have to go in and get a little piece of it, look at it under a microscope.
Oh,
So nobody can say, well, you had this mammogram, it looks like cancer, or you had this MRI, it looks like cancer. They can say it's suspicious, but
okay.
I don't allow people to say that word unless there's been a biopsy and a positive diagnosis.
Okay. So when you talk about the self breast self exams, and I know they have been and I am so guilty. All my life, or ever since I developed boobs, they talk about the breast exam. Do most women uh, discover cancers through self or suspicions through the self examinations?
Most of the cancers now are diagnosed through the mammogram. So we
Okay.
still teach you breast self exam so that you know that if there is a lump, you feel it.
Mm-hmm.
But the best way is your mammogram.
Okay.
And starting at the age of 50, if there's a history of breast cancer in the family, we want you to start at the age of 45.
Okay. And do you do those every year? The
Yes,
mammograms?
a mammogram is every year. And what you'll find now is they're trying to change some of the parameters, but starting at the age of 50, you should have a mammogram every year. And what you're going to see now is like they say they're recommending that at the age of 75 that you go to every other year. But I promise you, if I live to be 75,
You're
I'm going every year.
still going every year.
Yes,
Oh, okay.
ma'am.
Okay.
Yes, ma'am.
So are there a lot of diagnosis after? Why did they change the recommendation? Or then
They're changing it based on statistics.
okay.
And that's the way medicine works. You know, you base it on the statistics, but the most aggressive cancers, and especially in African Americans, is usually at 50 and younger.
Oh, really?
So
Okay.
uh-huh. So that's why we want to teach you the breast self-exam. And then if there's a change, you follow that up.
Okay.
If there is a family history, we want you to start earlier with the mammograms in addition to the breast self-exam so that we can, if there is cancer, it's caught earlier because the treatment has a better outcome. When I
Okay.
started cancer nursing in 1988, um, the statistics were that I got a few notes here because I want to make sure I'm giving correct information. The statistics were that the breast cancer was diagnosed at a much later stage.
Okay.
So the treatment was very aggressive and the outcome was not as good. We had a very high death rate. But now, stage one breast cancers are, we have a 95% cure rate, which means that
Okay.
at 5 years past, people are still living. So
See.
they're
Oh,
living with
okay.
it. And
Okay. So
that's a big difference.
can when it comes to treatment, um is it is there equity in treatment, or do sometimes the treatment options that are offered to like black women differ from the treatment options that are offered to white women? Is there an inequity in the options of
That
treatment
is
that are
a
offered?
that's a great question. There is not, and
There is.
I'll tell you why. There is a national cancer comprehensive network, and they determine the guidelines. It's through the National Cancer Institute, which is a
Mhm.
part of the National Institutes of Health. So it's a government agency, but they establish the guidelines for treatment based on the size and the stage of the tumor. So it
Okay.
doesn't matter, and that's blindly done. Doesn't matter if you're African American, if you're Mexican American, if you're
Oh,
Caucasian. The
okay.
recommendation is the same. Now, I will say one of the reasons why we really, really want our African American women to be screening early is because when it's diagnosed later in us, it's a much more aggressive disease.
Okay.
So
Okay.
because we're afraid. I did a talk this week, and a young lady that was in the audience at a church in Columbus, I could just see the fear in her eyes.
Mm-hmm.
So I stayed after and talked to her so that we could get her set up. She'd never had one. She's 56, and she's definitely afraid to go.
Okay.
So we want the education to take place so that we don't let this fear keep us from
Mm-hmm.
taking care of our body.
Mm-hmm. And I have heard people say that too. I don't want to if I don't want to know if something's wrong with me, which just confounds me that people actually say that. But I guess it's just that definitely fear. But I've always been the one that there's a problem, let's attack it.
Exactly.
Let's go ahead and attack that problem. Cause sticking our heads in the sand is not gonna help us at all.
Not at
Um,
all.
so um, the you or is cancer, you said that the treatment is the same, um so tell me, when would someone get a lumpectomy versus a mastectomy versus
Okay.
a double mastectomy? What dictates that?
Okay. So what happens is if there is an abnormality, there has to be a biopsy. Now,
Mm-hmm,
sometimes on the mammogram, we see the cells right inside the ducts of the breast,
mm-hmm,
and that's called ductal cancer in situ. So that means that the cells are abnormal right inside the lining of the duct, but they have not spread any further.
mm-hmm.
That is the stage zero.
Oh,
That's
okay.
the easiest to treat. They go in and do a lumpectomy.
Mm-hmm,
They make sure that they got it all, the margins are clear. And usually, based on the type of cells there are,
mm-hmm.
there's usually no further treatment other than follow up. So it can be
Okay.
a stage zero. It can be caught at the very beginning on the mammogram because there's an abnormality. Then the biopsy is next. And if there's a diagnosis and it's right there and has not moved, then it's ductal cancer in situ. And they go in, take that lobe out, that little lump out, make sure everything is clear, and so, most of the time there's no other treatment needed.
Okay.
So that's
Okay.
the earliest stage, is the best one to have it diagnosed, which is why we preach early detection.
Okay.
Then if it's a stage maybe one or two, which means that there's a tumor there that is larger and it has
Mhm.
grown, the cells have grown, and maybe they're right outside that area. Depending on the type of cell it is, because
Mhm.
there's lots of different categories, but the pathologist looks at it under the microscope and stages it. Now,
Okay.
if it's bigger than a stage zero, then the lady's also going to have like a PET scan to scan the whole body to see if there are any cancer cells anywhere else.
Okay.
They're going to have blood work. That tumor is going to be sent off for special markers, which tell us, is this a hormonal tumor, which is a good sign because that means that hormones will treat it,
Oh,
or
okay.
is it negative for hormones and certain receptors? So it's
Okay.
very, very complex, but the
Okay.
technology is awesome. So that dictates what type of treatment. Do they just need a lumpectomy? Also, they check the lymph nodes, which drain from the breast, which are under the arm. So we teach, when we teach you breast self exam, you also have to check under that arm, under axilla, to make sure you
Mhm.
don't feel any lumps or bumps under there.
Okay.
If there's a lymph node that's positive, that means that the cancer cell has traveled outside of where it started. So we
Okay.
may need a little more aggressive treatment.
Okay. Okay. And so, you said that when a woman is diagnosed with cancer, they automatically, breast cancer, they automatically do a PET scan to scan all the other organs or the rest of her body.
Unless it's at stage zero. If it's a stage zero, we usually don't see a PET scan.
Oh, okay.
But if it's outside of where it started, usually we're going to get a PET scan. We're going to get blood work because there are certain substances that tumors secrete in the body. So we're looking for those markers. So it's all together screening. It's not
Okay.
just the mammogram. If we have a
Okay.
positive diagnosis, there are some other things that have to be done.
Okay. And so, when you do a mammogram, from year to year, are they looking for changes in the breast?
They're looking for changes. They're looking for any. Sometimes they'll see a lot of calcifications, which are
Mhm.
calcium deposits. Sometimes that's suspicious. Depending, so they're looking from year to year to see, have there been any changes.
Oh, okay. 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 And so, like, for me, I'm a person who has dense breath, so
Yeah,
I
we
have
good.
to do
Talk
all
about
these
that.
different things. I have to do a
Yes,
mammogram, I have to do a 3D imagery and
yes,
a ultrasound and
yes.
all that. And that is common in Black women, right?
It's common and it's common in younger women. As we age, a lot of that dense tissue, and when we say dense, that just means it's packed kind of tight, as we're young. And I know this is a information, but we're gonna be real. As we're young, our breasts sit up, you
Right.
know, and so that tissue's packed really tight. And as
Mm-hmm.
we age, that tissue is replaced by fat cells.
Okay.
So that then it's less dense and it's easier to see if there's a change.
Okay. All righty. Mr. Jackson, do you want to stop and see? Oh, I see we have a couple of questions. Did you want to
Yeah.
go through them? Mm-hmm.
Um, there is a question. What does it mean when they say the breasts are dense? We want to attack that question first. Most of the other people are just speaking and thanking us for the wonderful education. They're really appreciative of us having this show, but we have the question, what does it mean when they say the breasts are dense?
Thank you, Mr. Jackson. So that means that the tissue in the breast is packed tight. The function of the breast is to breastfeed, is to secrete milk
Mm-hmm.
to feed children. So those tissues and those cells are packed very tightly, and that gives the breast its form. That's why they sit up. We don't have to have a lot of support when we're younger.
Mm-hmm.
And then as we age, that dense breast tissue that's packed so tight together is replaced by fat cells. So the fat makes it easier to see those changes on the mammogram.
Okay.
They're less dense.
Okay. And so you said about breastfeeding, and I wanted to ask you, is it true that women who have not had kids are more likely to have breast cancer? And if so, why?
It puts them at a higher risk. Breastfeeding is actually protective to women when it comes to breast cancer because that breast is functioning, it's secreting the milk, the hormones are interacting with it. And so that we see less cases of breast cancer in women who have breastfed.
Oh, okay.
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 We've got another. We've got another question or statement from Shantasha Johnson Learns. She states that she's been diagnosed with lobular carcinoma.
Hmm.
It has never caused cancer because I was told it had never left the duct. She wants to know, have you ever heard of this? The lump was benign and removed.
Okay, if it was lobular carcinoma, carcinoma means cancer. And the lobular cells are those milk producing cells. So if it was inside the duct, it was lobular carcinoma intraductal. That's the term. And when you remove that lump, remember I said if it's still in the duct and it has not traveled anywhere else, that lumpectomy is usually curative.
Okay, so she wouldn't have needed any other
Treatment.
treatment. Okay.
Correct.
Okay.
Yeah,
And just a
she,
reminder, ladies, if you are a survivor, please put that in the chat so we can make sure that we get everyone's name so we can give gifts to those who are survivors. But go ahead, Mr. Jackson, did you have another?
well, I was getting ready to do that same announcement that you
Oh, okay.
just made.
Okay.
Remember,
Okay.
producer, you're
Okay.
the host, I'm the producer.
Oh, yes,
So,
sir.
but I think we're good. We've got several guests, and we want to say hello to everybody. We're
Okay.
not going to call everybody out because if I miss somebody, it may cause some harm. But thank you so much for joining us. But as Juju has said, if you're on this live with us, you have to be on the live. We want you to place in the chat, I am a survivor. And we will contact you and arrange an opportunity for you to come over November 2nd and pick up your gift. We're going to give all of our cancer survivors that are on the call with us tonight a special gift. And we just need for you to to let us know. And Dr. Reese, Shantasha Johnson Learns would like to talk with you after the live. So if you would like, I can send her your information.
That's
So
perfectly fine.
okay.
Thank
So
you. I'd
Miss
be happy
Learns,
to.
I'll send you Dr. Reese's information and she will gladly speak to you. May I do something a little bit unorthodox?
Okay.
Um, I've been knowing Dr. Reese for quite a while. She's always been Alveta or Vita. Um, and she's always been like our sister. My sister in the law and her were best friends. They were members of the nursing sorority Chi Phi. But I'm going to tell you, and this is very humbling to me. Anytime there was any type of a medicinal issue, question, it didn't even have to be cancer. We would call her or my sister-in-law, and they would be Johnny on the spot. And it was so amazing they could diagnose things over the phone and say, get them to the emergency room or they need to go to the doctor. But it was so amazing to me the care that she gave my sister-in-law,
Oh,
who was I think Liddell was it 10-year cancer survivor? I believe she was. She was a 10-year cancer survivor. That's one of the strongest women I've known. I mean, even when she was in her latter days, my niece called me. She said, "Uncle, she doesn't want us to come down here. She don't want you coming down there. She's okay. She's fine. Just let her do." And uh, but I say all of this to say, nursing is a special gift. Everybody can't be a nurse. Everybody can't be a Florence Nightingale. And one thing that I can say about Dr. Reese, I've seen her go from a just a regular RN all the way up to this phenomenal um, educator and giving us wonderful information. So she's my personal friend. She's almost like she's really my sister. And we thank you so much for educating us. And that is the only other comment that I've seen
okay.
other than, well, let's see, we've got another one. Okay. Thank you, Joyce. Joyce said it is a gift, and it is. And we don't want to take for granted all this wonderful information that you're providing us. And I want you to speak on males
Hmm.
for us, for me as a male. What do I
Yes.
need to be cognizant of? What do I need to be doing? You know, we have testicular cancer, prostate cancer. We just have a plethora of things, and we always equate breast cancer to women. And in my research, I see that it's just as prevalent with men as it is for women. So, what do we need to be doing as men?
Thank you. I um have that right here. This year, 300,000 women will be diagnosed with breast cancer and 3,000 men.
Okay.
So if there are changes, the same thing that we teach women, if there are changes in the nipple, if there's changes in the skin, if the skin around it starts to look like an orange peel,
Mm.
that's suspicious. If the nipple starts leaking or you start getting a discharge from
Mm.
it, or pain in the breast, if one breast starts to get bigger than the other, that's we still want men, if there is a difference in the body, we want them to make sure that they follow up and get that taken care of. In the years that I've given chemotherapy and treatments, I have treated 4 men,
Oh,
and 3 of them were African American. They
really?
done well. They're doing fine. They came through the treatment and did great. Because in a man, it's going to be more noticeable if there's a change.
Okay.
So they're usually diagnosed very early.
So,
So,
Dr. Reese,
it's the okay. Is the survival rate the same for men and women, or does it usually be more aggressive in one or the other? The breast
It's
cancer.
because we diagnose so many more women. The survival rate is higher in men.
Okay.
But what we see is in African American women, um, they have a 41% chance higher than the Caucasian woman that it's going to be a more aggressive disease.
Oh, okay.
And that's because we have less of those hormone positive breast cancers.
Mm-hmm.
Like I was talking about those receptors, it's and we check it in men too. We check the estrogen receptor, we check the progesterone receptor, and the HER2 receptor. Now, if those things are positive, that means that the treatment will be easier and it'll be better.
Oh,
There's a better outcome with the treatment. But if those things are negative, that means it's a much more aggressive cancer. And we see triple negative breast cancer at a higher rate
women.
in
Okay.
African
Black.
American women.
Okay. And what about cancer overall? Is there a difference in the cancer rate overall?
Overall, the number one cancer diagnosed in this country is lung cancer. And
Uh-huh.
in all of those cancers, the death rate is higher in African Americans, but that's because
Early
it's usually
detection.
diagnosed later.
Okay.
So that's why the message is early detection. We have the survivors can tell us. I mean, they are survivors. So that's why we want people to know that hey, these people are surviving cancer
Mhm.
and they're surviving breast cancer. And that's really the message. It is not a death sentence. The early
Okay.
detection gives you better treatment options, better treatment, and better outcome and results.
Okay.
so we've got a question here, which is the same question that I was going to ask. Is women have mammograms, and what type of a test or what physician, what type of a doctor does a man or does males need to go to have the test conducted?
If a man has a difference or notices a difference in their breast, pain, swelling, discharge, change in the skin, any difference in their breast, they'll go to their general practitioner, their general medical doctor, who will take it from there, make sure that there are x-rays done, and if needed, a biopsy.
Okay. So, and you said that men are usually diagnosed earlier, so I guess there's not any kind of stigma or anything attached that prevent men from coming in to get
No,
these tests.
men are not men are not really, we have a lot of trouble getting our men to the doctor, but let me tell you something. If something strange start happening up there, they're coming.
Okay. Okay. Well, that's good because you are so right. You have trouble getting them to the doctor and getting their normal annual exams and
Right.
whatnot. So, but say if some start leaking or hurting up there, they coming to the doctor, huh?
And remember, it's a lot of times it's their women who realize, hey, what's going on
Yeah.
there? That feels funny. That doesn't look right.
Okay.
So yeah,
Okay. Okay.
it's just
Okay.
more obvious in them.
Oh, okay. Okay. Um, so, what else do you want to let us know in the Black community, Black women? Anything else that you want us to know
A
specifically?
couple of things. There are risk factors that we can change. We can't
Okay.
change being a woman or a man having breast tissue. We can't change our family history. We can't change our age. But the things that we can change that would decrease our risk, number one, maintaining a healthy weight, increasing our fruits and vegetable intake to 5 servings a day, limiting our alcohol intake, being physically active. Let's increase our activity. Park further away, count your steps, go up on your steps. Those little changes make a difference because then you have a habit formed.
Okay.
Breastfeeding children, we already said that those moms who can breastfeed, it is very protective to mom and to baby. And then there are some of us who, maybe having early menopausal symptoms.
Mhm.
We try to steer away from hormones
Mhm.
for menopausal
Mhm.
symptoms as well.
Okay.
So those are some things we can change. The only other thing and I think this is part of my platform, is the medications for health in general, blood pressure meds, heart meds,
Mhm.
all of those meds have been studied on average white men. So we don't know which medicines work best for African Americans because we have not been enrolled in clinical trials.
Wow.
So I really want to educate us about clinical trials, and that may be something later that we can do. But
Okay.
tonight, I want people to know that it is important that we enroll in clinical trials. And that doesn't mean that they're going to give you some weird pill. It doesn't
Mhm.
mean that they're going to give you some strange treatment.
Mhm.
Because of the U.S. public health study and the syphilis study that was done
Right.
in
Right.
Tuskegee,
Mhm.
there are very stringent protections in place for people who enroll in clinical trials. You
And
have to be
that's what I
well,
was.
you have
Oh, go ahead.
to be well educated.
Mhm.
You can stop the trial at any time you so desire,
Mhm.
and you have to meet the criteria. But that's something that I've personally had an ability to see from the other side. And things are not going to be really working for us until they're studied on us.
So how do and I know that a lot of African American Black people are skeptical or afraid
Right,
because of the syphilis
right.
experiment and thing in Tuskegee. But my question is, how would one go about being enrolled in clinical trials?
Well,
I can
what you do
talk
is
to
if,
that.
okay, great, great,
I can talk to that because I am in my second clinical
good.
Oh,
trial. Um,
okay.
I thank God for Emory University. And when I went through all of the rigmarole and seeing death's door, I became the poster child for CHF at Emory University. I was invited back to speak to a team of highly intellectual medical professionals, and they asked me would I participate in clinical trials because they just what Dr. Reese said. They said we don't have enough information on African Americans, and we're not going to do anything to harm you. This is only going to help people like you. It's going to not only help you, but everybody else that comes after me. We're not going to give you any strange meds. We're not going to do anything. It was just a battery of things that I went through, and even when you go to your doctors now, if you're diagnosed with congestive heart failure or your high blood pressure or your advanced kidney disease, whatever the situation is, they are going to ask you, would you like to be a part of this clinical trial? And the greatest thing about it, you get paid and you can opt out at any time that you desire. And there's a battery of question surveys that you have to go through, interviews, and every time you go to the doctor, that information is passed on to that clinical trial because they want to see what they're doing and how your body is functioning after you have congestive heart failure. And I'm still living today because I'm a clinical trial specimen. They have now worked to get the chemicals in my body aligned with the medications.
Mhm.
And, you know, I went to my cardiologist just recently and she said, "Oh my God, you're doing so well. How are you able to control your fluid?" And then she said, "Oh, the medications." And
Mhm.
it was back to the clinical trials. But to Dr. Reese's point, um, they offer that to you if you go to the doctor enough or if you've been
Mhm.
through some type of medicinal concern. And thank you for sharing that. Then we've got a
Okay.
question.
So, but
About,
wait a
we've
minute.
got a
Let me
question.
ask.
Okay.
Okay, yeah, but let me ask one more thing about the clinical trial. I want to ask Alvita. Um, and Mr. Jackson's at Emory, and I know that's a research hospital.
Mhm.
But what about locally?
Locally, I've done some in the last year. I've started doing some research on Parkinson's disease, and that's something
Mhm,
that just came to me, and had an opportunity to look at it. And from my education about it, I was able to enroll myself and my husband in a trial, and all they're doing is following us.
mhm,
Because again, I had the opportunity to work in a clinic at UAB for 3 days. We
mhm,
treated 80 patients a day.
mhm.
In those 3 days, I only saw two African American people
Enrolled in
in
that.
that clinic. In that clinic, there were about 30 healthcare professionals, and I was the
Mhm.
only African American in the building.
Oh, okay, okay,
So I
okay.
know that, you can do clinicaltrials.gov, and you can look and see some of them, like the one we're in, is just monitoring us over the years to see were there some things that contributed. Did we get Parkinson's? The nurses in the country, we've all been in a trial for like 7 years, and it
Mhm.
started with baby aspirin,
Uh-huh.
when they said that they thought baby aspirin would help with colon cancer, and they followed us for 7 years.
Okay.
So there are things that are out there.
That are
And if
local.
you're
Okay.
interested in looking, you can just do clinicaltrials.gov,
Okay.
clinicaltrials.gov. And they're not all experimental things. A lot of them are just monitoring.
Monitoring. Oh,
Um,
okay.
mhm,
Okay.
mhm.
All right, Mr. Jackson, go ahead with the question.
Okay. Okay. I did post that link. Um, the
Bless you.
Oh, bless you.
excuse me. There is a question concerning alkaline water. Is it true that drinking alkaline water help keeps cancer away? It's said that cancer cells can't survive in alkaline water. Is there any truth to that?
That is a myth.
Mhm.
There is no research that supports that. Also, the big myth over the last few years is eating according to your blood type. There's a whole book out about that,
Mhm.
but there is no research that we found in a research institution that supports
Oh,
that. So
okay.
that's a big message to people too, is if you hear these things or see these things, you can go to cancer.gov or
Okay.
the National Cancer Institute.gov and look there, or even cancer.org,
Okay.
because they're going to tell you this is a myth, that is a myth. Let's see, there was something out about if you buy underwear, if you buy a bra and you don't wash it, it could give you cancer. I have heard all kinds of things,
Oh,
and none
okay.
of that is substantiated.
Okay. So, and you said you wanted to talk to us about some common myths about breast cancer. So, since we're dealing with myths, we could just go on and let you talk about the myths.
Okay. Like I said, um if you get mammograms every year, that's enough radiation to give you breast cancer. That is not substantiated. We've heard that. We've heard that using deodorant can cause breast cancer.
Uh-huh.
Now,
Uh-huh.
the aluminum in the deodorant is at question, but there is no research that substantiates that. There is research
Okay.
ongoing looking at, they're starting to look at that.
Okay.
And then using perms and hair dye, it
Uh-huh.
does put you at a higher risk for cancer, but it's endometrial cancer. It's not
Okay.
breast cancer.
And so when I want to talk about, ask a question about the perms and the hair dye. So if you start at a younger age with those, like with kids at a younger age, does that put them at a higher risk?
It does
Just
increase your risk. It
okay,
does, because
okay,
the longer you use it, and the research is showing that your cells start to mutate
okay,
because of the chemicals.
okay, okay. All right. Okay, so
Um,
that is not a myth about the perms and the hair dye.
right.
So I need
But it's,
I need to let my hair go gray.
I'm
Is
not
that what
going
you
to the natural girl, never ever. Me and Jesus just gonna handle it.
said?
Not
Okay,
gonna do it.
so I can keep putting a little dye, a little color in here.
Listen. I teach at a university, and my students say, Miss Reese, you just love that creamy crack. I said, long as they make it,
So
long as they
that
make
make it okay. All righty. So are there any other myths that you want to tell us
it.
about?
Eating too much sugar can cause breast cancer. We've heard that. That's not true.
Okay.
Now there is in the research just coming out that there may be a link in with a high risk in breast cancer with type 2
Oh,
diabetes.
oh
So
really?
they're looking at that right now. That's
Oh,
something that's ongoing in the research right now.
okay.
But it hasn't been proven. It just
Okay.
looks like there may be a link. So as soon
Yeah,
as they get
definitely. Okay.
results enough, they'll let us know that. And one of the things that um, all of us do as medical professionals is we make sure that we stay current.
Mm-hmm.
What's out there, what's been proven, what has not been proven, because it's so important that people know correct information, which is why I'm so thankful to you guys for that. Also, only old women get breast cancer. My youngest patient was 26 when she was diagnosed.
Mm-hmm.
She's a professional woman. She's thriving today. I treated her 14 years ago, and she is
Okay.
doing fine.
Okay. Okay.
Question.
Okay.
Okay. All right. We have a question. Is it possible that there are holistic things that are helpful to help fight cancer that research hasn't caught up with?
Well, what the research would tell you is that the complementary therapies like aromatherapy, music therapy,
Mm-hmm.
those things that help you overall individually, that help maybe boost your immune
Mm-hmm.
system, some of the herbs that do that, that they help you holistically with your fight if you have cancer. The reason we have to be careful about that is because some of the herbs may interfere with the
Right.
treatment. So if you're gonna just do holistic treatment, you want to get all the opinions. That's your right.
Mm-hmm.
But you want to get all of the opinions. You want to go ahead and look at the medical opinions and what they're telling you. If you have a holistic person, you want to look at all of that. And it is always the patient's choice.
Right. Oh.
But what the research shows is that those complementary therapies can assist you because they boost your immune system, they boost your emotional
Mm-hmm.
wellness,
Mm-hmm.
which overall contributes to your health.
And so would like stress that would decreasing your stress would increase your overall uh, reaction or response to your treatments.
Yes.
Oh,
Yes.
okay. Okay. Um, what I had another question. And that what happens when you get to be a late of a certain age. It slips your mind if you don't come on out with it. Uh, I see is a did Miss Clifton have a question? Oh, okay. She was just thanking. Um, Dr. Reese. And this is we do appreciate you so much and this is breast cancer, but we want to have you back because we want to talk about other health issues
Sure.
and especially their impact on the Black community, men as well as women, and especially when it comes to cancer and the things that we can do to help stave off some of these diseases
Sure.
and what we can do if we have been diagnosed. And I have a one other question because I've always been of the mindset that if I had a cancer diagnosis, and praise God, I haven't had a breast cancer diagnosis, I would just want them to take the whole breast, both of them, all of them. Is that an option, or would a doctor say no if he didn't think that it was
It
necessary.
depends. It depends on the type of cancer and the stage. Now,
Mm-hmm.
I personally, if I ever get diagnosed with triple negative breast cancer, I will not stop until I have a bilateral mastectomy,
Okay.
because breast cancer doesn't come unless there's breast tissue.
Okay.
So
Oh, okay.
that's my personal, um, and if I were 30 years younger, that might not be my personal choice.
Right.
But that's
Right.
my personal choice now, because I
Mm,
know that it's an aggressive cancer. And I know that even if they take out the lump or take off one breast, it can
mm-hmm.
recur in the
And
other
the
one. So
other
that,
one.
depending on what type of cancer is, what the stage is,
Mm-hmm.
that's what they're going to recommend based on,
Okay.
remember that
Y-
standard of
Yeah.
treatment that I talked
Uh-huh.
about?
Mm-hmm.
That's
But
their guide.
yeah. But my question was, if I just demand that I want to, because you
Oh yeah,
see
there's
some
a
women.
surgeon that'll do it. Yes, ma'am.
Oh,
You
okay. That's what
you
I
find
want to
somebody to
know
do it. Yes,
because
ma'am.
I see some women and they say, well, the doctor's doing this, and I have a friend of mine, and she had a family member, and they kept doing the lumpectomies, and the cancer kept coming back in different
Hmm.
places. Now, of course, the young lady has metastatic breast cancer
Hmm.
because they kept doing
Hmm.
the lumpectomies, and I'm just thinking, did nobody ever suggest that she have a double mastectomy or
Right.
anything like
And
that? That's why I asked the
so
question about the disparity in care between black and white women.
I'm glad you asked that question too, because if we don't advocate and say, and sometimes we may not know enough to say, but that's why it's so important to get the information. And I'll just give you, and I know he doesn't mind, but my brother-in-law right now is an end-stage renal patient who already had one amputation. Well, then the other foot started and the toe, and then they wanted to go back. And I called my sister. I said, no, call me when the doctor gets in the room. I
Mm-hmm.
said, has he had a study to see what his circulation is like in that
Mm-hmm.
leg? No, ma'am.
Mm-hmm.
That needs to be done today.
Mm-hmm.
And where his circulation is good, we're going to take that other leg. We're not
Okay.
going to
Okay.
be going back and forth and this
Doing
piece
a
and that piece.
toe and doing the
I'd already talked to my brother-in-law. I said,
uh-huh.
listen, we don't want you to be sick. We got to get you well and up and moving again. And this is the
Uh-huh.
way. This is the
Okay.
only way. So it's so important to seek that information, so that if they're telling you something and that you don't feel like it's right, you seek a second opinion. You find somebody who will help advocate for you,
Mm-hmm.
and you find what you need,
Mm-hmm.
because you know your body and you know yourself.
Mm-hmm. Yeah.
Very good
Okay.
information. We've got two questions, and then we're going to end it. This has been a phenomenal
It has.
conversation.
Thank
So,
you so
one of the
much.
questions is there a concern in the medical community that the hormones in food may be a it may cause a disturbance in our cells? And the other question is there an age when you should stop getting mammograms?
Okay, question number one. Yes, there is a big concern about hormone in our foods.
Okay.
Um, a lot of times now, because of the way we eat and what we eat, the amounts we eat,
Mm-hmm.
that combined with the lack of exercise and movement and the obesity crisis that we're in, there is very makes people very susceptible. Obesity is a huge risk factor in all cancers.
Yes.
So
Okay.
it
Okay.
really contributes that way. And the question number two, I can't remember it now.
Is there an age when you should stop getting
The
mammograms?
the American Cancer Society has come out with a recommendation that after the age of 75, you could go every other year. And then I think it's 80, you can go like 5 years. Um, and I just know of somebody personally who's 90, and the doctor told her she didn't have to have them anymore. But it's a personal thing.
Okay.
They'll be covered as long as they need, if I'm a woman and I feel like I need a mammogram, you're going to be covered for it. But the older we get, they're recommending now that we can space them out.
And I have one more question, Jerry. And I know you said we're going to end, and we are because we're about out of time. When you talk about obesity, are we supposed to go by that little chart that them doctors give us that want us to be anorexic?
No, ma'am.
Okay. I, I,
That's the ideal. The word is ideal body weight. But you
okay.
and I know that ideal body weight is not necessarily ideal for
For
us.
us.
What you want is a weight where your blood pressure is under control, your blood sugar is under control, and your weight greatly influences those two things.
Oh, okay. Okay. All right.
Increase
Well,
your activity.
okay. All right, Mr. Jackson. That was my last point because I was like, Lord have mercy, if I get down to that 150 that them doctors be telling me I look like I was, oh Lord have mercy, maybe a runway model.
Well,
Anyway,
hey, I feel the same way. I am working. I'm in a dilemma right now, so I don't know what I'm going to do. But thank God I'm not diabetic, so that's a good
Yes.
thing. So we're going to go ahead and go to our announcements. Next Sunday, of course, it will be getting out the vote, election eve. Next Sunday, we'll be talking about getting out the vote. And next Saturday, St. Luke AME Church will be hosting their annual fall festival at 11 o'clock a.m. to, I believe, 3. But at any rate, we're going to be having on the phenomenal historic campus. Come join the fun. It's going to be a tailgating event where Auburn University will be playing Vanderbilt University Commodores, and you'll have an opportunity to watch it on the big screen. There will be free popcorn, lemonade, and candy, fun and games for the children, and you'll be able to shop local vendors. Vendor spots are still available for only $25. Please contact Juju or Dean Thomas, Duchess Thomas, or myself if you are interested in vending. Hold Up the Light will be available for rides to the polls on Election Day. I will pin that phone number in the chat so you can go back and watch it and get that information.
and also,
Make
Mr.
sure,
Jackson, just on that one, you'll be able to sign up at the fall festival too,
okay,
for rides if you come by there.
okay,
Okay.
thank you. Also, make sure that you have a valid state issued identification because that is required to vote in the state of Alabama, same in the state of Georgia. If you do not have an ID, you can get one free. You can contact Hold Up the Light, and I'll give you that phone number in the chat. Um, if you have any questions on how and when to vote in your state, you can go to iwillvote.com. Again, that link is iwillvote.com. And please don't forget to support and subscribe to the Divinely Guided Podcast YouTube channel. You'll be able to view new episodes every Monday. I think they drop around 6 o'clock p.m. Central Standard Time, featuring the dynamic mother daughter team of Duchess Thomas and Adrielle Vincent. I'll also post that in the chat. And we really need for all of you to subscribe to Juju's Dollhouse YouTube channel. You'll be able to keep up with everything that's going on with By Juju for you and catch any of the wonderful editions of Let's Talk that you may have missed. And I'll post that link as well. And By Juju for You is a phenomenal and proud sponsor of Hold Up the Light Huddle. Thank you, Dr. Reese, for a phenomenal discussion. I have been enlightened and educated, and according to our guest, they have too.
Mhm.
So thank you for all of you that have tuned in. Please don't forget to like and share um, this show so that we can get more people out. We want to become big. I want to see Juju become famous, and I'm going to do everything I can to help her.
I'm,
I turn it back over to
I'm
you,
already
Juju.
famous, infamous one. Well, anyway. But thank you so much, Dr. Reese, for everything. Thank you for taking your time out of your busy schedule. I know you are busy. This has been a great discussion, and preferably you will come back and join us and help us because we want to get information to our community to help improve every aspect of their life, including their health. Because a healthy you is the best you. If you're not healthy, then you
Absolutely.
that you know
That's
if
right.
you if the health has to come first. So thank you so much. Thank you so much. I do I will be in out of pocket this week, but I am going to try to come on, sometime just to give you updates on the election. Uh, Hopefully I can go to the ellipse. I'll be in Washington D.C. If I go to the ellipse, I'm gonna let y'all know. Okay, I'm gonna come live, so y'all be looking for me on the ellipse. But anyway, thank you guys so much. Thank you to everyone for tuning in. I just love you guys so much. I just love you. Love you, Mr. Jackson. You know I couldn't do a thing without you. So thank you so much. Remember, let us get informed and make our plan to vote. The election is upon us. So make our plans to vote and encourage everyone around you to vote. Your vote is definitely your voice. Before I go, I have to say hello, Journey. If I don't say hello to Journey, she gets mad with me. Hello, my pretty little miss. Juju loves you. But anyway, okay, so I am Juju. I am that mountain moving giant slayer. I am walking by faith, inspiring hope, and showing love all along the way. Until next time, I wish all of you much love and many blessings. Good night. Don't
No,
forget, hey, if you are a survivor, don't forget, I am a
Nobody,
survivor. Put
nobody,
that in there. Nobody?
nobody.
Oh,
Mm-mm.
okay. All right then. Well, I guess I'll send them a beautiful hats instead of giving them away. Okay.
Well, I'm
All
sure,
right. Uh,
and
Good night.
I'm going to send your information to Mrs. Lawrence. Okay, Alvita.
yes, thank you so much.
Okay, sure.
All right. Good
Good
night.
night.